Next, from the governor's office in the state capitol, Governor Pat Quinn briefs reporters on his plan to address the severe deficit in Illinois' Medicaid program, a program that funds medical care and nursing home care for about 2.7 million people in the state. This runs about 15 minutes. The full 40-minute press conference is available on our website.
I want to welcome everyone to the governor's office. I think this is an important day for our state and our budget. During my budget address a couple of months ago, I talked about the need to rescue our Medicaid program in Illinois. Medicaid is a program, a health program. It deals with 2.7 million people. More than half the births in Illinois of children born are done on the Medicaid system. It's a vital system. It's very, very important to our state, and we have to make sure that it is here today and here tomorrow. And so I said we had to work night and day in order to restructure the program. Last year, the expenditures of Medicaid were $1.9 billion more than the revenues for Medicaid. That's nearly $2 billion of bills of Medicaid from last year coming into the new fiscal year. So we could not continue at this pace. The Civic Federation, which has done a rigorous study of the program, found that if we did not restructure the program, that in 2017, 5 years from now, the bills would be $21 billion. And we just can't afford to do that. The system would implode, and it would eat up everything in state government. We have important priorities in state government: education. I was with some students this morning. Public safety, that's something we always have to be cognizant of. And those priorities are as important as health care. And so we have to balance our priorities. So I commissioned a work group made up of representatives and senators of both parties in both houses. And they came together and have worked under the leadership of Julie Hamos, our director of our Health and Family Service Department. And I want to salute Julie Hamos for doing an outstanding job. Talk about an outstanding public servant. Day after day, week after week, worked with the members of the working group and other members of the legislature who wanted to come by and learn about the issue, to come up with a menu of reductions and efficiencies, cuts necessary in order to restructure and stabilize the system. It wasn't easy, it was very difficult, but necessary in order to save the system, to rescue the system, to have a system of health care for our most vulnerable residents all across Illinois, 2.7 million people, lots of them children. We have to make some fundamental changes. Now, these are difficult changes, but if we don't make those changes, we won't have a system at all. So it's very, very important that we understand that at the outset. In our work group, I'm very proud of their efforts. They did their very best. They identified a number of areas of economy. I think there were 58 separate items where there are either reductions or cuts or efficiencies that we're going to be proposing to both houses of the legislature. And the savings amount to about $1.15 billion, a significant amount of money. But we have to do more. We have to ask our providers, those who are involved in the healthcare system, to tighten their belt. And we are doing that by asking them to make economies of $675 million. Total of cuts, efficiencies, and reductions to the providers are about $2 billion. That's a significant amount of money. Now, there's a big health care issue in Illinois that's afflicted many citizens of our state for many years, and that's smoking and cancer caused by smoking and other tobacco-related diseases. We've worked with the American Cancer Society, which has pointed out that one of the very best ways to reduce Medicaid costs now and in the future, and we want to have a program that deals not only with today, but stabilizing our Medicaid program for years to come so that it is sustainable. And one of the most important ways to do that is to deal with the issues of tobacco-related disease. This is something that is a very large cost driver in our Medicaid system and has been for some time. Now, we could stand on the side and do nothing about it, but there's a proven strategy that has worked and will work in Illinois at reducing smoking, especially by young people, and that's to raise the price of cigarettes. I think the people of Illinois understand that it's important that we have healthy people, especially healthy young people. And in order to prevent young people from smoking, price of cigarettes is a key issue and variable. So we're going to raise the price of cigarettes in Illinois by $1 a pack in order to get revenues that we need for our health care system, about $337 million, something like that. And the extra bonus that comes with that is that allows us to get federal matching money of $337 million. That is something that we should not pass up. I think it's a very important ingredient in a health care program in Illinois to reduce smoking, reduce the costs related to tobacco, and also get federal money, matching money of hundreds of millions of dollars to help us pay our Medicaid bills. So this is a balanced approach. It starts, number one, with preventing fraud and abuse. We don't want anybody in the Medicaid system that isn't eligible for the Medicaid system. So there's some very strong, tough safeguards here that we want to work together with the legislature and everybody in Illinois. If someone's not eligible, they don't belong in the Medicaid system, and they'll be taken out. And there's significant reforms in our package to carry that mission out. There are also, I think, very strong efforts to switch from a fee-to-service system in Medicaid that isn't always based on outcome and more on provider payments to a wellness system based on coordinated care. We want to make sure that those who are in the Medicaid system are focused on health and wellness and prevention. And so our coordinated care system will be accelerated. It's very important we do that. And we also want to make sure that we get every single dollar we can from Washington for any kind of investment in health care. So that's what our plan is all about. It's designed to make sure that we reform the system, restructure the system, have a balanced system, maintain the system for the most vulnerable people in our society who need health care, but at the same time understanding if we don't rescue the system today, it will get worse day after day. If we don't deal with this problem right now, it'll just get worse. It'll be billions and billions of dollars out of balance. We can't afford that. We have to act today. We have to act responsibly. We have to have members of the General Assembly who step forward and do important things, not just for now, but for the future and the common good of the people of Illinois. And that's really what our system is all about. Because if we don't act, our important investments in health care, as well as education, and definitely public safety, will be put in jeopardy. Because the squeeze that will come from accelerating Medicaid costs, not paying the bills, having a system that is out of whack, out of budget, out of balance, will harm other parts of our government in Illinois and harm the people of our state. So we must take this stand today. Look forward to working with the General Assembly to pass this package, a balanced package, a reasonable package. And I think we can make our state a whole lot better by so doing. Be glad to answer any questions.
Governor, could you go into a little bit more of what you're going to do to cut down on fraud? And last year, Director Hamos testified that she was still using 30-year-old computers. Will you propose any new spending to upgrade those computers to help in that effort to cut out on fraud?
Well, I think information technology is part of what we want to use to ferret out any kind of fraud or waste. As a matter of fact, we wrote a letter to our counterparts in Washington telling them we're going forward with our fraud and abuse initiatives to get rid of fraud and abuse anywhere it might crop up in Illinois. We have to have that as our first order of priority. It's part of program integrity. We have to have integrity in the system. You have to use modern information technology. That we have to make these investments. I think they pay for themselves in great dividends and savings by using computer technology to make sure that folks who are not eligible, who don't have the necessary or have an income above what is eligible, are not in the program. At the same time, we understand that we have to have a program for those who are eligible. So we've had to make these direct changes that I'm proposing today, and I believe that when the General Assembly looks at the whole package of our plan, it's a good plan. It's a plan that will help Illinois today and tomorrow.
Will that include having more than one pay stub? Will that include showing that you're actually a citizen of Illinois? I had Children's Memorial Hospital told me they lost $50 million from having Medicaid children come over from Indiana. So they can't.
Well, I think that is an important part of our fraud prevention efforts, that we don't want those who are not from our state to take advantage of the people of Illinois. I also think it's important to keep an eye on whether the income is proper or not. We've already told Washington, our counterparts out there in the federal system, that we have robust fraud prevention initiatives in this program. We feel they comply with the federal law, and we're going to implement them. I wrote them a letter and I said we're going to go forward with these programs. And I know that Julie Hamos, who is our director, feels as strongly as I do that no one who is ineligible for Medicaid should get Medicaid. Having said that, we have to be realistic. There are millions of people in Illinois who are eligible, and we have to have a humane and decent system that does provide for their health care, but at the same time it can't be an extravagant or wasteful system, a system that is really, I think, behind the times. We have to have a wellness system that focuses on prevention of disease, and that's exactly, for example, when we talk about cancer and cancer caused by tobacco-related diseases, we aren't going to just stand still and let that happen. We want people to be healthy in Illinois.
Governor, the working group hasn't been able to agree on any plan, let alone this particular one.
Yeah.
Those people who are the most knowledgeable and immersed in this problem can't agree to go forward. Why do you think you can get this to the legislature?
Well, we're going to have to pass it, obviously, because if we don't pass the plan that I outlined today, and it's a $2.7 billion solution to the Medicaid problems that we've been faced with, so we won't run a deficit. We still have to pay $1.9 billion off from last year's budget that are unpaid bills. So, but if we don't deal with the $2.7 billion gap this coming fiscal year, then all that money will have to be taken out of other priorities of state government, things like our schools, and things like our public safety, and things like our construction on the highways and byways of Illinois. Our capital program will be put in great jeopardy. So having said that, I think members of the General Assembly may not be wildly excited about this plan, but it is necessary. And that's what governors have to do. They have to tell the legislators what they need to know, not always what they want to hear. They want to hear good things all the time, but sometimes these are difficult things, important things that are necessary to stabilize a system that is out of control, that is way over budget, and we have to bring it back to earth.
Governor, today, in light of the concerns from the healthcare sector that removing $2.7 billion all at once could trigger a recession in that sector, cause thousands of people to lose their jobs.
Well, we are happy that our economy is doing better in Illinois. We still have a long way to go, but our unemployment rate announced today is down from last month. It's as low as it's been since February of 3 years ago. So, no, it will not. I think the bottom line is for those institutions that provide health care, and I honor all of those healthcare providers, our hospitals, our nursing homes, our doctors, all of those who work in the healthcare profession, our nurses. I honor their work. But having said that, if we don't take the necessary steps to restructure the Medicaid program and achieve economies and efficiencies, if we don't do this, then the whole system will collapse. And if the whole system collapses, there won't be jobs for people. So we have to make necessary steps in order to rescue the system from collapse. Now, having said that, I think our program is a very prudent one because it focuses on wellness and health and good outcomes. We are not just going to run a Medicaid system in Illinois that's focused only on payments to providers. We want to make sure that the recipients, the clients of Medicaid, have good health. And that's why we are concerned about their health in its entirety. And this program thinks about that and puts a strategy together that's good for today and tomorrow and for the next generation. We have to restructure this program and have a 21st century Medicaid.
Are you prepared to agree to more benefit cuts? The Republicans
Well,
are saying there's not enough cuts.
well, yeah, they're fine. We're happy to listen to anything anyone has to say with respect to efficiencies and reductions, but they have to be, I think, prudent ones that don't end up costing us more than we save. And I think anyone who has looked at history in Illinois, you know, I've been around here a while, Governor Thompson had 2 increases in the cigarette tax when he was governor. Governor Edgar, who I served with when I was state treasurer, had 2 cigarette taxes when he was governor, and Governor Ryan had a cigarette tax increase. So that's 5 cigarette tax increases that have occurred under Republican governors. Now, I think I've looked at all the studies done by health experts, and if you want to get healthier people, one of the very best ways to do it is to get people to stop smoking. It's one of the largest drivers of cost in our Medicaid system. Now, the proven strategy of preventing more people from smoking and continuing to smoke is to raise the price of cigarettes. That's just common sense. All the health care experts tell us that, and we're going to follow that policy because in addition to saving lives and reducing smoking, especially among young people, literally thousands of young people won't begin to smoke in the first place. In addition to that, we can get a bonus of $337 million from Washington. Now, I think anyone who is wanting to do a budget, if you can get more money from Washington, you should go for it. And I think raising the price of cigarettes in Illinois, as you know, we're 32nd highest in the country. There are 31 states that have a higher cigarette tax than we do. So I think those folks who are saying no to that ought to rethink their position. They're losing millions of federal dollars. They're not helping the health of the people of Illinois, and they're not helping solve the Medicaid challenge.
The governor, have you ever tried to quit smoking? It's not that easy. You know, you get a dollar any way you can. You smoke?
I do not. I never have, but I am sympathetic to anyone who is trying to stop smoking, and especially I'm sympathetic to parents who don't want their kids to smoke. And study after study, in state after state, have found that if you raise the price of cigarettes, young people who are most susceptible to starting smoking won't begin in the first place. And if you look at the cost of our Medicaid system, the billions of dollars we have to pay over the decades in smoking-related diseases, we have to have a prevention strategy. And that's exactly what our program is here. It's designed to prevent people from smoking. And if they are smoking, hopefully getting them to stop or reduce their smoking.
Doesn't that reduce state revenue? Senator Ryder has said if you base this plan on an unstable revenue source, you're going to have to go back to the well in a few more years.
Well, the bottom line is if you have healthier people, then hopefully we won't have to have as much expenditures in the first place. So this is a prevention strategy. It's based on a variety of things, including a Medicaid system that is much more focused on coordinated care than just fee for service. We don't want a bunch of silos focused on paying this or that provider, and the recipients, the clients of Medicaid, end up not as healthy as they should be. So we want a much more focused system on prevention and wellness. That is really a 21st century Medicaid system, and that's what our plan is.
Governor Quinn, you've been around here a long time when you were treasurer. You've known that Medicaid has been a problem. Why did you wait until now? And also, why did you wait until you got elected in 2010 and after the primary here?
Well, I think our plan is a necessary plan. As you know, Ray, we had a grave recession that harmed our whole country, definitely our state. That happened about the same time I arrived as governor. I got sworn in January of 2009, and our country was in the worst recession since the Great Depression. Now, anytime you have a recession, that means more people are going to lose their jobs, lose their health care, they come onto the Medicaid system. We've had a great number of increases in that. Number two, the federal government did provide a stimulus, a help from Washington for a couple of years for all the states, not just for Illinois, and we were able to use that money to help stem the tide, but the federal stimulus has expired. And number three, with respect to the Medicaid system, last year we made proposals to the General Assembly on reducing costs. They chose not to adopt those proposals. In fact, they decided to take the money, the excess bills, and just shove them into this fiscal year, almost $2 billion. So we had to take a stand this year, and the stand is this. We have to have a system this year that takes $2.7 billion out of the costs of Medicaid. And we are doing that, I think, in a very prudent way, a balanced way. There are providers who will have to make sacrifices. There will be efficiencies in the programs and options and eligibility that the system has, and we want to get as much federal money as we can, and we also want to have a strategy of preventing bad things from happening to people, particularly due to cancer, tobacco-related diseases, that will save us money today and tomorrow. So I think this is the time to do it. I have not been shy about telling the General Assembly that if we don't do this, then the budget will be harmed elsewhere, and Illinois as a state won't be as strong as it should be.
Governor, I don't understand. Can you explain why, on the cigarette tax increase, when the legislature tried to pass it in 2010 and it failed, it didn't get called, and the same thing happened in 2011. Why is this not a non-starter? And then you talk about keeping people around in the summer. If you don't get the cigarette tax increase, is that something you're prepared to?
Well, there'll be, if that doesn't happen, we'll lose $337 million from the federal government. We will then have to cut out of our budget about $675 million from the rest of the budget, from our schools and our public safety. You've been covering all these hearings dealing with the facility closures. You see how excited some legislators get if even one facility is proposed to be closed. Well, if they want to cut another $675 million out of the rest of the budget, they're going to have more facilities closed and less money for our schools. And I don't think that's a prudent strategy at all. So I do think the time has come, the moment has come for members of the General Assembly, particularly in the House, because the Senate, as you know, has passed the raising the price of cigarettes on 2 occasions, and I commend them for that. And I hope they do that again, and certainly the House members have to understand that we have to have a strategy in Illinois of preventing bad things from happening in the first place. We got to use our common sense, and common sense is raise the price of cigarettes so young people in particular don't smoke. The statistics are that thousands of young people won't start smoking if the price of cigarettes is too high.
Governor, why not use gambling expansion instead of a cigarette tax increase that has trouble passing? I mean, the expansion passed.
Expansion what?
Gambling expansion. Why not use dollars from that to help fund it?
With respect to that, I've laid out a framework, I think a very prudent framework that focuses, number one, on integrity. We've got to make sure that anytime you have gambling, you have proper and strict watchdogs and oversight. We can't have excessive gambling, as some want here, but I don't think the people do. I've proposed a prudent plan of 5 casinos. That's plenty enough for me, and I think for the people. And then also the money we want to make sure is focused on education. That's my plan, and members of the General Assembly, I think, would be prudent to follow that framework with respect to gambling. But, you know, anytime you have a challenge, some people don't want to meet the challenge. They want to talk about something else, gambling or whatever. I don't think that's the way to go. This is our moment with respect to our health care system. We must have a good health care system. It's called Medicaid. Millions of people rely on it, especially babies. And so we must have a good system. And we will have a good and decent system, but it must be restructured for the 21st century. Now, I have a director who's put her heart and soul into this, Julie Hamos, and she's done a very good job of leading the work group. Now it's time for the members of the General Assembly to rise to the occasion in the best traditions of Illinois democracy. When I was governor, Jim Edgar, he proposed a cigarette tax. That passed because it was necessary at the time. And the same thing should happen now with respect to that, but also all of the efficiencies need to be enacted in order for this system to go forward in a proper way in the 21st century.
Governor, I'm told that the Medicaid providers are already going to be stretched out to about 270 days in the next fiscal year. That's 9 months. If you cut their compensation along with that, what would you say to those who say what you're going to do is end up having more and more providers just not take Medicaid patients, and so therefore these proposals are going to actually damage the very recipients you're saying you're trying to champion?
I respect the hospitals and the nursing homes, the pharmacists, all of those who are in the providing health care in Illinois. They do very important work. At the same time, the reimbursements that they receive have to be reduced, and that our plan does that. It isn't, I think, a radical reduction. In fact, if there are some that might want to reduce it even more than I've proposed, and I don't want to do that. I would like to keep the reductions of provider reimbursements as economical as we can. But we have to have a balanced plan, and our plan has many efficiencies and cuts in eligibility and options for those who receive Medicaid, and then it also has some efficiencies and reductions for the providers. It's got to be sacrifice because if you don't do this, all the folks you just mentioned won't have a Medicaid system at all. It'll be broke. It'll be bankrupt. And it's not just me talking, by the way. You know, I read the Civic Federation study of this a couple of months ago. It was a very rigorous study, and it said if you don't do anything, you just stand by the side of the road and let inaction take its course, the system will be $21 billion in debt. So those providers will be waiting a lot more than a few months for their payments. They'll be waiting years. We can't have that. And I also was interested when I read the Civic Federation report, they actually said one of the ways of dealing with this challenge is to raise the price of cigarettes. So I took that to heart after reading it. So I think we need to understand that now is the time for a bipartisan solution to a very difficult problem. I have no compunctions about the fact this is hard to do, but that's what we're in government to do. We're here for hard things, important things that matter to the common good for years to come. And so that's why we're going to go forward with this plan, working with the legislature and make the economies necessary.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.